Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Alyssa Hritzik. We have a lot of healthful information for you in this episode, including colonoscopies are important to screen for potentially dangerous polyps, a local physician explains. This Grand Island woman credits her primary care doctor with making lifestyle changes easier. She'll share her story. And you'll learn how specialists diagnose and treat patients using advanced radiology technology. First, a Lake County hospital is celebrating implementation of advanced technology that leads to better outcomes for critical care patients. Florida Hospital Waterman is the first in Lake County to implement ECMO.
So ECMO, or extracorporeal membrane oxygenation, is the ability to allow us to actually oxygenate the patient without actually utilizing their lungs. It's pretty amazing when you think about it, that for the first time now we can let your lungs rest while we're actually oxygenating you. The original technology developed in the late 80s for babies, neonates who had stiff, severe lungs, and it's developed out of that from large machines that almost filled a room to a very small machine. It's kind of like sci-fi medicine. We've actually removed your lungs from the process of breathing, and you're actually on a machine that is giving your lungs time to rest. So it's truly what it is. It's extracorporeal, out of your body, membrane oxygenation. We are oxygenating you out of your body. Many people see the movie Coma, which you kind of live in a suspended animation with the machines doing all your care. That's kind of what it starts like. We have you heavily sedated, essentially asleep, essentially taking over your body control. We're maintaining your metabolic rate, we're maintaining your oxygenation, your perfusion, your nutrition. But as time goes on and we start transitioning you from the machine to your own lungs.
In addition to patients with severe lung conditions, such as pneumonia, ECMO helps cardiac patients.
So I like to think of this as a treatment to allow the two most important organs in our body, our lung and our heart, time to rest and heal. And it's interesting, what we have found is if you give those two organs time to rest and heal, they do great, and patients recover.
Just knowing that we have this available for our patients. It was like when bypass surgery became available to our patients in Tavares and Mount Dora. We didn't have that before. The cardiac surgeons, the intensivists, and our nurses have all been just really excited about the fact that we're able to be the first ones in this area to have this.
We had a vision here at Florida Hospital Waterman about 2 years ago that we saw our patient population changing. A heart program we were developing, our ICU was getting busier. We realized as the largest community hospital in Lake County that we needed to think forward and start this program. So with the support of administration and staff and the support of our entire service line, we developed an ECMO program and instituted it this past January, and have already had a couple success stories. Why is it important? People live here. This is their county. This is where they're from. If I take somebody who's sick and have to transport them to Orlando or potentially somewhere else, they've got to leave the community. It can be problematic. We can provide that same level of care here because we have the doctors, we have the staff, and we have the technology, and there's no reason to need to transport these people. We're the first and only service line provider in Lake County with ECMO available, and I think it provides a resource to our community.
You can learn more about ECMO by visiting fhwaterman.com. Recently, more than 100 Lake County women learned about ECMO's success, as well as local resources available to help prevent and treat heart disease. It was important information because heart disease is the #1 killer of women. Florida Hospital Waterman's 5th annual Women's Hot Topic Breakfast, held last month, included a panel of experts. Part of the discussion focused on the connection between heart disease and diabetes.
In general, diabetes significantly increases the risk of cardiovascular events, and then it also increases the risk of not being diagnosed as quickly because women come in with different symptoms: fatigue, nausea, pain between the shoulder blades, like our other guests talked about. Diabetes, so it's an inflammatory, high inflammatory state, and that was the point I was trying to make. So anytime the blood sugar is high, you have decreased wound healing, you have basically, in general, the blood pressure is not as well controlled, so it prolongs the recovery from anything, in particular wounds or surgery, and even just a cardiovascular event, right? Because you still have disease.
Mount Dora resident Joanne Phillip, who had triple bypass heart surgery last year, shared her story and urged attendees to pay attention to their health.
There are so many women that ignore symptoms of impending heart disease, heart attacks, and so on and so forth. And there are women that don't have doctors, that they don't think that they need one. Going and having particular tests done if if your sugar levels are high and so on and so forth. So it all encompasses what women's health is all about.
You'll find plenty of heart health related resources by visiting the website on your screen. Next, many Lake County patients are experiencing better outcomes due to advanced procedures which are performed by specially trained radiologists.
So part of it is we have a big background in imaging, and basically it's a multidisciplinary approach to what we do. We work a lot with other physicians, just helping them problem solve and figure out what's wrong and how to treat it, and then treating the disease itself for us as well. And so we'll review their imaging, say if it's something we can treat or not treat. We'll see the patients and consult and talk with them, discuss the procedures and maybe what some of their treatment options are.
It may be appropriate for some patients to be treated by an interventional radiologist.
Interventional radiology, we use imaging to do minimally invasive procedures for people. So we use either ultrasound or live x-ray, we call fluoroscopy, or CT. We do stuff head to toe in the body. I do biopsies, head and neck area. We treat lower extremity stuff and open up blood vessels, shut off blood vessels, do biopsies, drainages, chest tubes. We do intra-arterial therapy to open up blood vessels or stop people from bleeding. We do intra-arterial therapy to treat cancer. We actually put probes in with imaging guidance into tumors and burn or freeze the tumors to kill it.
Dr. Stewart says he enjoys the variety of procedures that his specialty can offer to help patients.
As a young guy that was thinking about a career in medicine, I think surgery is what excited me the most. And so once I got into a radiology rotation, I worked with the interventional radiologist doctors, and they were doing just cool stuff. It taught me a lot of procedures and just how to care for patients. And so I'm just grateful to be able to follow in the shoes of those guys, to learn so many things from so many people, to be able to bless the lives of other people.
You can learn more about the numerous interventional and diagnostic radiology services available locally by visiting the website on your screen. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. Sudden weight loss prompted this woman to get medical help. You'll learn about her diagnosis and how her doctor has changed her life. A Tavares physician wants Lake County residents to know about the dangers of colon cancer and how to screen for it. And a delicious dinner in minutes may be what you and your family desires. We'll visit the Con Recreation Health Center with an easy recipe. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. You might want to check out these upcoming community events. Don't go away. Waterman Wellness will be right back.
Now it's time for the Creation Health Tip of the Month. Regular activity benefits your mind, body, and spirit. Today, revitalize these areas of your life by ending your workout with meditation or prayer.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Alyssa Hritzik. Local experts stress having a primary care physician can be critical in preventing the onset of chronic disease. In our next story, a Eustis family practice physician explains that a patient-doctor relationship takes teamwork.
Every new patient hears this from me. We're a team. I'm here to make recommendations based on your health status. I'm here to educate you. And that's my job. I'll give you the medicines based on what you need, if you need medications. The other part, it's you. That's why we're a team, because you have to work on your diet.
Dr. Rodriguez diagnosed Betty Daniels with diabetes after the Grand Island woman lost a lot of weight unintentionally.
She didn't want me to gain the weight back, she just wanted me to be healthy. And she gave me a diet to follow, and really they wasn't that bad. She just made it even better the way she told me what to do and how to do it. She said, "You're on your own." She told me more or less, but she said, "I just want you to, you know, cut out sweets, not as many sweets, a walk." And she just told me what she wanted me to do, so I tried to do it.
Dr. Rodriguez says seeing a primary care physician once a year can help patients better manage chronic disease.
Annual exams are very important for different reasons. For people, for example, that have chronic medical problems, you want to go to the doctor and check the status. Where are we at? If you have high blood pressure, if you have diabetes, are we under control or have we fallen off the wagon? Do we need to do some things to correct those things? So in that sense, the more medical problems you have that are chronic, the more important it is for you to go and check those out. And if you're overall no medical problems, no family health, no family history, then you fall into preventive care. What are the things that we need to start working on to prevent things from happening later on?
I was scared because I didn't want to do what my dad had to do. My dad had to take shots, and there was a lot involved in what he had to do whenever he had the diabetes, because he was so far much advanced into the diabetes than I was. I just think she's just wonderful. She's caring. She cares about what I feel and what it is for me. She cares. And you can tell by the way she asks you questions, the way she acts.
Remember, medical care should always be individualized. Tell me about you, and then we'll tailor what we need to do based on what you're telling me.
You can find a specialist to partner with you and your family on your health by visiting fhwaterman.com. Next, a local gastroenterologist wants you to know about an important screening that may help identify a potentially deadly disease.
So colon cancer is the second leading cause of cancer death in the United States, but the key is it's a preventable cancer. The problem is that polyps, which are the early lesions that we're trying to detect, you're asymptomatic. Now the best test that I would recommend, something that could directly visualize the colon, is the colonoscopy. And a colonoscopy is a procedure that the physician uses a long tube with a camera at the end of it and a light, and is able to go into the colon directly, look for these polyps, and remove them if they're there. That procedure does require sedation, and it's a 2-day affair, I always tell patients.
Dr. Cavelli says the anesthesia used in a colonoscopy is easier for most patients to tolerate.
Patients walk away from the procedure with maybe some air, but that's easily passed, but they're able to go out to eat afterwards. They continue on their day comfortably like nothing ever happened, and able to resume work the following day without a problem. Polyps over time, if left in the colon over time, they can develop into a cancer. And see, by removing those polyps, I can prevent that patient from ever developing cancer in their lifetime. And we are lucky in a sense that we have a test such as this that can prevent that from ever happening.
Visit fhwatermancancer.com to learn more about colon cancer prevention and local resources to help you and your loved ones. Good nutrition contributes to digestive health, among many other things. But do you know what to prepare? Next, we visit the Con Recreation Health Center kitchen, where the Florida Hospital Waterman team will show Michelle Wargo a healthy recipe.
If you're looking for something quick and easy to make and clean up, then this is the recipe for you. I'm joined by Florida Hospital Waterman Executive Chef Dave Atkinson, and we have registered dietitian Stephanie Bassett. They're going to share with us this quick and delicious pasta recipe that will help keep us full?
It will definitely help keep you full. It's a really good source of fiber, so it helps prevent your risk of chronic disease.
Oh, fantastic. So it's really good for digestive health.
That as well, yes.
Fantastic. So Dave, what goes into this?
This is a nice hearty pasta dish. Today we're using a whole wheat penne pasta, which I pre-cooked just in the interest of time.
Okay.
We got artichoke hearts, Parmesan cheese, salt and pepper, parsley, yellow onions, grape tomatoes, cannellini beans, and olive oil. We're going to start by sauteing our vegetables in the olive oil.
So the vegetables that he's talking about, what do we have? We have tomatoes and we have cannellini beans and artichoke hearts.
The artichokes are an excellent source of fiber, and they're also one of the top antioxidants according to the USDA.
And they're delicious.
And they are very delicious, yes, very true. Onions have a lot of different antioxidants in them as well, so they're good for our immunity, and they're also beneficial for our gut bacteria as well.
Oh, I didn't know that.
So our vegetables are sauteed. We're going to add our pasta.
So with pine nuts, you can just put the nut in whole?
Yes, these have been toasted slightly. They come raw normally.
Okay.
We toasted them in the oven for a few minutes.
A little salt and pepper.
Pine nuts. Parmesan cheese.
Yummy.
So at this point, we're pretty much done. Just put it on a plate.
That was quick. I mean, if you're trying to cook this at home, wow.
I think the most time-consuming part is actually making the pasta.
Yeah, and that takes, what, 7 minutes to boil? Yeah.
Dave, are you gonna try it, Dave?
Sure. Yay! This is the first at
I
Waterman
know.
You'll find the recipe by visiting watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the April episode right here on Lake Sumter TV for some of the following stories. Atrial fibrillation can lead to serious health issues. A local cardiologist explains how the heart condition can be treated with a minimally invasive procedure. You'll find out about specialized therapy used to help breast cancer patients with discomfort after a mastectomy. And Chef Dave will have a delicious dessert recipe using fresh produce when we revisit the Conry Creation Health Center. To learn more about the experts featured in this month's program, please visit watermanwellness.com. Until next time, I'm Melissa Hritzik for the award-winning Waterman Wellness.